Hi everyone, so on this video, we are going to share with you about ultrasound scanner in medical. Before we start, let's get to know my team members, which is me, Nurul Huda, Izzah Nadira, Nur Syafiqah, Nur Fateha, Nurin Safura and Nur Najah Farzana.
For the introduction, I'm going to share about the ultrasounds. Ultrasounds, also known as sonography or ultrasonography, is a non-invasive imaging test. An ultrasound picture is called as sonogram. Ultrasound uses a high-frequency sound waves up to megahertz to create a real-time pictures or video of internal organs of other soft tissues from inside of our body. Ultrasound does not use radiation like X-rays. Furthermore, ultrasound is a similar technology that used by radar that allow the healthcare workers to perceive the details of soft tissues inside of the patient's body without making any incision. Therefore, it is safer to use ultrasounds, especially for a pregnancy checkup or to see parts in internal organ and soft tissues in the body without conducting any surgeries. To perform the ultrasounds, a special lubricating jelly or low viscosity gel will be applied to the skin part of the organ or soft tissues that want to be perceived. This action is to prevent the friction while they rub the ultrasound transducers to the skin. The transducer sends high-frequency sound waves through the body. The gels also help transmit the sound waves. The waves echoes as they hit a dense object like bone or organ, as those echoes then reflected back into the computer. Since the frequency of the sound wave above the human hearing threshold, which are 20 kHz, these sounds will form a picture that can be interpreted by the doctors. Then the sonogram is produced. There are three types of ultrasounds, which are diagnostic, functional, and therapeutic ultrasounds. Diagnostic ultrasounds is a non-invasive diagnostic technique used to image inside the body by using a transducer. For functional ultrasounds, it includes Doppler color and Doppler ultrasounds to visualize the blood vessels in the body and heart. And lastly, therapeutic ultrasounds produce high level of acoustic output that can be focused on specific targets for the purpose of heating, ablating, or breaking up tissues. There are also types of dimension in ultrasound, such as 2D, 3D, and 4D. For example, during the pregnancy, the 2D ultrasound image of the fetus is appeared. The 2D ultrasounds produce outlines and flat-looking image, which allows the healthcare provider to see the fetus' internal organs and structure. For the 3D ultrasounds, it allows the visualization of some of the facial features or body parts of the fetus like fingers and toes. The 3D ultrasounds also have been used for other medical purposes, such as evaluating uterine polyps and fibroids. For the 4D ultrasounds, it's actually a 3D ultrasound in motion, which is a video in 3D. Sonographers rarely use the 3D and 4D fetal ultrasound imaging for the medical purpose, even though it can be helpful for other medical purposes.
Next, I would like to explain about explanation of relevant to scientific instrumentation and application concept. First, transducer. The transducer is the core component that emits and receives ultrasound wave. It converts electrical energy into sound wave and vice versa. Piezoelectric crystals are commonly used in transducer due to their ability to generate and detect ultrasound wave. Next, ultrasound wave. These are high-frequency sound waves, typically above 20 kHz, that penetrate the body and bounce back off tissue and organs. The time it takes for the wave to return provide information about the density and composition of the structure they encounter. The third one, probe. The probe houses the transducer and is placed directly on the patient's skin. It's designed to optimize the transmission and reception of ultrasound wave, providing high-quality image. 4. Beamforming. This technique is used to focus the ultrasound beam in a specific direction, improving image resolution and quality. It involves adjusting the timing and amplitude of signals sent to multiple elements within the transducer array. 5. Signal processing. Raw ultrasound signal undergo various processing techniques to enhance image clarity and reduce noise. These include filtering, amplification, and speckle reduction algorithms. 6. Image reconstruction. Once the signals are processed, they are reconstructed into a visual representation of the internal structures. Different imaging modes such as beam mode, which is bright mode, Doppler, and contrast enhanced imaging provide valuable diagnostic information. The last one, real-time imaging. Diagnostic ultrasound scanner provide real-time imaging allowing healthcare professionals to visualize moving structure like blood flow, heart valve, and fetal development. This real-time feedback is crucial for guiding intervention and monitoring procedures.
Next, I will explain the detailed exploration of the chosen application. There are 4 different modes used in medical imaging. First, A mode. A mode is a single transducer scans a large human body. A mode is one of the simplest type of ultrasound. Therapeutic ultrasound is one of examples that use a mode to target a specific node in the body. Second, B mode. B mode is a two-dimensional ultrasound image display composed of 2 bright dots representing the ultrasound echoes. The brightness of each dot is determined by the amplitude of the rated echo signal. This allows for visualization and quantification of anatomical structures. This B mode is great for image-guided injections for needle placement of an injection procedure. It also can visual cardiac and vascular movement across the cardiac circuit. Third, M mode. M stands for motion. In M mode, the rapid sequence of B mode scans follow each other in sequence on the screen. This enables doctors to see and measure the range of motion. There are the boundaries that produce a patient more relative to the report. Lastly, Doppler mode. This mode uses the Doppler effect to measure and visualize the blood flow. Doppler sonography plays an important role in medicine. These measurements use the Doppler effect to assess if structures, usually blood, are moving towards or away from the probe and their relative velocity. The Doppler information is displayed graphically using the spectral Doppler or as an image using color Doppler or power Doppler. Color Doppler shows the direction of the blood flow in red or blue, while spectral Doppler not only shows the direction, but it also shows the phase and acceleration of the blood flow. In addition, power Doppler sonography is a new technique that displays the strength of Doppler signal in color rather than speed and direction information. Next, we move to how does an ultrasound machine work. Firstly, ultrasound machine emits high-frequency sound wave that penetrate the skin and bounce off internal organs and tissues. These reflected waves are recorded to create an image of the body's inner structures. The frequency of sound wave is between 2 MHz to 50 MHz. Affects their penetration and reflection. The higher the frequency, the shorter the wavelength and the more attenuation. For example, 3.5 MHz was present on the shortest frequency of ultrasound scale. This frequency is used for abdominal ultrasound to study the deep abdomen. And the highest frequency is 50 MHz that study the musculoskeletal system and other superficial masses.
Next, the example of the real-world implementation. They have 3 types of ultrasound and each of them has different function, and they are diagnostic ultrasound, functional ultrasound, and therapeutic or interventional ultrasound. Firstly, for diagnostic ultrasound, it is able to do non-invasively image internal organ within the body, but it's not good for imaging bones. One of the common uses of diagnostic ultrasound is during pregnancy. It helps to monitor the growth and development of babies and also to monitoring the health of developing baby. It also has many other usage such as to image heart, blood vessel, eyes, thyroid, brain, breast, abnormal organs, skin and muscles. Next, for functional ultrasound. Functional ultrasound include Doppler color and Doppler ultrasound to visualize blood vessel in the body or heart. It shows whether the pulse is present and whether there is blood flow to a limb. It helps to diagnose or manage a condition such as peripheral arterial disease, PAD, or diabetic foot ulcer. Next, there are another form of functional ultrasound, which are elastography. It is a method to measure and displaying relative stiffness of a tissue, which can be used to differentiate tumors from healthy tissues. For the next slide, it shows us the example of Doppler color ultrasound and the elastography ultrasound. For the first picture, it's a brain that use Doppler color ultrasound. Actually, it shows the blood flow. So the brighter pixels show a higher blood flow, while the lower pixels show a slower flow. For the next picture is elastography ultrasound. On the right picture, it shows that the lesion has mixed stiffness with hard elasticity, which are the red areas with the white arrows, and the cystic component on the blue area indicates by black. Lastly, for the last ultrasound is therapeutic and interventional ultrasound. Therapeutic ultrasound produces a high level of acoustic output that can be focused on specific targets for the purpose of heating, ablating, and breaking up tissues. One type of therapeutic ultrasound based on heating uses high intensity focused ultrasound or HIFU. It used to destroy tumor or abnormal tissues without having to tear up skin or damage around the tissues. While another type of therapeutic ultrasound that based on non-heating is extracorporeal shockwave lithotripsy or ESWL. It used to treat problems such as gallbladder stone. Fluoroscopy is used to targeting the acoustic focus on the stone.
There are many benefits of ultrasound, such as it is non-invasive and safe for patients, widely accessible and gives real-time imaging. Ultrasound is non-invasive because it does not need any needles or injections. It is safe for patients, especially for pregnant women and fetuses, because ultrasound use sound waves, so there will be less risk and no harmful effects. Ultrasound may be uncomfortable to patients, but does not be painful. Ultrasound also is widely accessible, including small hospitals and clinics. It is also easy to use and cost-effective equipment compared to MRI and CT scan. There are also have portable ultrasound machines that allows to use in different situations, including in isolated locations or by the side of the bed. The last benefit is ultrasound gives real-time imaging. It gives a clear image of soft tissues and gives real-time assessment of moving structure, including the heart, blood flow, and fetal movement. Ultrasound also is the recommended imaging modality to diagnose and monitor pregnant women and also their fetuses. Unfortunately, ultrasound also have some challenges. The first challenge is ultrasound is difficult to penetrate deep layers in human body. This is because ultrasound use low-energy sound waves, which the sound wave does not travel well through bone or air. It is difficult to use ultrasound for imaging the brain, lungs, or deep structures for obese patients. The second challenge is difficult to obtain ultrasound with high diagnostic quality and increase the physical strain on radiologists and sonographers. In some patients, the liver and important abdominal organs may be 4 to 5 cm below the surface. This can be caused by the patient habits, body movement, or overlaying gas. To penetrate the tissue, the radiologist must use a lower frequency probe which can result in loss of resolution. Regarding some tissues and structures, ultrasound might offer a different of detail than CT or MRI imaging. So, if the low frequency probe malfunctions, the radiologist must use a dose-producing CT scans or more costly and time-consuming MRI exam.
The next slide is about the future development and innovation. Diagnostic ultrasound could make some innovation to enhance power saver through energy harvesting. Energy harvesting or power harvesting is a process of electrical energy capture from converting system environments such as kinetic energy and thermal gradient to usable electrical energy. Out of many energy sources, piezoelectric energy system is the energy derived from vibrational motion and mechanical pressure. With that, it can produce self-powered electronic and stand-alone system. Until now, batteries are mostly used to power implantable devices and have need of charging or replacing batteries. Therefore, energy harvesting would be the way for strong power supply for implantable device. Hence, it will avoid inconvenient situations include extended hospitalization and increased health threat to patients.
To conclude, ultrasound has been used on many instruments that will bring benefit to humans. For example, is probe, which is providing high quality image for ultrasound. Ultrasound has 4 types of modes that evolve along with modern technology today, namely A mode, B mode, M mode, and Doppler mode. This modern device will help medical staff diagnose patient illness more accurately. The newest ultrasound now more advanced by using high-frequency sound wave that penetrating patient skin and internal organ. In addition, ultrasound have 3 types which has its own use include diagnostic ultrasound, functional ultrasound, and therapeutic ultrasound. Diagnostic ultrasound are safe for patients and being used for every hospital in the world. However, it's difficult to penetrate deep layer in human body. Therefore, there are some improvements could be made on diagnostic ultrasound so that it can be used for a long time.